Hey guys, Davin Lim, board certified dermatologist. Today we'll be talking about how to use alpha-hydroxy acids, like how a dermatologist should or would use them. So, as a background, alpha-hydroxy acids include acids such as glycolic acid, lactic acid, citric acid, and mandelic acid. And these acids form the basis of skincare. So you can use it in one of two ways. You can use it on a daily basis, in other words, as part of your normal skincare routine, or as what most dermatologists do, we use it in a pulse manner. In other words, use it infrequently in a cycling manner. And when I mean infrequently, every 7 to 14 days. So guys, what does alpha-hydroxy acid do to your skin? So first of all, they can act as a powerful exfoliant. Basically, an exfoliant means to take the top layer of your skin off. In other words, increase the cell turnover of your skin and helps to make your skin brighter. So if you suffer conditions, for example, like pigmentation, whether it be melasma or it be sun damage or any form of actinic pigmentation, alpha-hydroxy acids can reduce the amount of melanin buildup. In other words, the amount of pigment or unwanted pigment in the upper layers of your skin. Think of it as a gentle chemical peel. And what it does is to reduce your compaction of your cells. In other words, it breaks the bonds between your cells, which hold your cells together, which means the cells at the upper part of your skin will desquamate or come off a lot easier. So you can use this, generally speaking, in the morning or preferably at night. The reason why most dermatologists don't like to advise morning use is that alpha-hydroxy acids can be photosensitive. In other words, when you put on these alpha-hydroxy acids, it can react with light and make your skin a little bit more photosensitive. So most of us advocate use at night. So which ones do we like using? A lot of us like to use something called glycolic acid. Glycolic acid is an acid which is a little bit smaller compared to the other acids. With a low molecular weight, glycolic acids penetrate the skin a lot easier. The flip side about easy penetration of your skin is that if you suffer sensitive skin, so for example, if you have eczema, dermatitis, or rosacea, the glycolic acid molecule can penetrate all the way down in between your cells to the bottom layer and hence may cause irritation. So if you have sensitive skin, consider a large molecule, something like mandelic acid, because the penetration is a lot less compared to glycolic acid, and hence the flip side is that irritation is a lot less. So if you're considering glycolic acid, generally speaking, start off with a concentration between 5 to 15%. Here's the catch. It's not just the concentration that matters, it's the pH formulation. In other words, the pH of the actual acid itself. The lower the pH, the higher the bioavailability. So low pH, so for example, you might have a glycolic acid, which is pH of, for example, 1.8, but it's only 10%, compared to something, for example, like 15% with a higher pH. Chances are the one with the lower pH, with the lower concentration, will act a lot faster and it'll be a lot more powerful than that with a higher concentration, but also higher pH value. Get it? Good. So glycolic acid, start between a 5 to 15% formulation. If you're going to use it as part of your daily skincare routine, you might want to use it at night. So you might want to apply it after a bath or after a shower. Generally speaking, for glycolic acids, we're very cautious when we're combining it. So for example, if you're using other acids, for example, like ascorbic acid or vitamin C, there is a possible interaction. The reason being is that it can make your skin more sensitive. The same applies to things like retinol. So if you're going to use things like retinol, you might want to use your retinol, for example, over the weekends, and you give your skincare acids a break Saturday, Sunday, and you might want to use your 5 to 15% glycolic acid serum Monday to Friday nights. So we talk about glycolic acid. Another acid which dermatologists like is lactic acid. Lactic acid can be used on areas of the face, but also can be used on your arms and shoulders. So lactic acid is really good for conditions like keratosis pilaris. Lactic acid can also be used to help brighten your skin and treat dry skin. So lactic acid, believe it or not, is super cheap. You can buy formulations which don't cost very much at all, anywhere between $10 to $15, and you can use it on big surface areas. Glycolic acid is a little bit more powerful, but it's also a little bit more expensive compared to lactic acid. And for those of you who have really sensitive skin, you might want to consider something like mandelic acid, which is basically a bigger molecule and hence can be used by most patients who have sensitive skin. Guys, we talked about using glycolic acids as part of your daily skincare routine. How can you use them, or how do dermatologists like using them? So most dermatologists like to use super powerful glycolic acids or alpha-hydroxy acid combinations, generally speaking what we call a pulse manner or cyclical manner. In other words, we like to use them in specific intervals, and the intervals may be, for example, 10 days ranging all the way up to 20 days. Personally, my favorite formulation is to use a super strong AHA once every 2 weeks. So basically what that does is to help exfoliate your skin a lot more effectively. And hence we're using a much higher concentration, something like 20, even 22% alpha-hydroxy acid in a very low pH. But you can't use that on a daily basis, because what will happen is that you're going to cause some skin irritation. So what we do is that we can either use a standalone formulation, alpha-hydroxy acids, higher concentration, low pH, or alpha-hydroxy acids combined with something like a beta-hydroxy acid, which is something like your salicylic acid. And what we do with those pulse concentrations, generally speaking, it improves your collagen stimulation and also reduces your pigment a lot better than using it on a daily basis. It's almost like a mini peel. The difference between peeling using glycolic acid and using a glycolic acid serum is huge. For peeling solutions, the pH is much, much lower. So we call this as unbuffered or mildly buffered alpha-hydroxy acids compared to your buffered alpha-hydroxy acids in skincare. With chemical peels, you gotta actually start slow. So you have to start at somewhere between 15 to 20%. And what dermatologists do is that they increase that over time. So you might go something like 15, 20%, and then 2 weeks later, you go for something like 30%, then possibly 35%, 50%, all the way up to short contact glycolic acid, 70%. You can't use these high concentrations in your skincare or you'll burn your skin. So guys, just to summarize glycolic acid and how to use it. Number one, you can use it as part of your daily skincare routine. That can help, but then that limits you as to what you can apply on your skin, for example, like your retinols and your ascorbic acid because of skin irritation. The second way is to use it in a pulse manner. In other words, once every 10 to 20 days, you can go up for a higher concentration, and that does not stop you from using your other topicals on a daily basis. Guys, I hope you liked that video. Please like, comment, share, subscribe, and I'll see you next week.